members, if you have any questions, signify. I do want to ask one just to make sure.
Yes, sir.
When you talk about the transition, that's just transit. Am I hearing you correctly? That's just transition of the responsibility and employees, but that's not necessarily saying that we have transitioned to a full state exchange.
That's correct.
Okay.
That's correct.
I think there might be some questions on that.
Yeah, no, we do not have a full state exchange.
Okay. Representative Farrar, sir.
I think you kind of answered my question. Thank you.
Okay.
Well, it's fine. It's all right. I think. I almost called her Representative Kerr. I'm sorry. You said in your statement that the transfer to the state exchange will free us up to 1332 waivers.
Right.
Okay. We had an expert at the task force a couple of weeks ago that said that we didn't need 1332 waivers or a state exchange to eliminate in South Carolina.
I'm going to leave that question to Ms. Smith.
Okay. Can I get her to answer that question?
Certainly. I think the commissioner had finished his remarks, so you just go ahead and state your name and who you were.
Certainly. My name is Cheryl Smith Gardner, and I am the Executive Director of the Arkansas Health Insurance Marketplace. And just before I respond to your question, I wanted to echo everything Commissioner Kerr said. I commend the legislature for not ceding regulatory control, particularly on the insurance front, to the federal government. While the commissioner is correct, there is no federal Department of Insurance. There was created in 2011 a department within CMS that for those states that go with the federally facilitated marketplace, it's a Department of Insurance Oversight, and they do regulate. They are not a full federal department, but this is clearly federal creep, and I again commend the General Assembly for their vision and their foresight in creating the state-based marketplace. Now, I think, Representative Farrar, you might be talking about Mr. Lonnie Chen. So let me go back a little bit, just by a little bit of history. So I actually met Mr. Chen several years ago. I was a fellow at the Heritage Foundation, so was he. So we've been working on healthcare reform for a number of years. No state has to do a 1332 waiver. No state has to do a state-based exchange. However, states that decide to do any kind of premium assistance, which is frankly what conservatives and Republicans have been fighting for a number of years, rather than putting people into traditional Medicaid, you put them into private insurance. If you're going to do any kind of premium assistance program, you will need some kind of exchange mechanism for people to go in, be determined eligible for that premium assistance, shop for their coverage, and then enroll in their coverage. One of the documents I prepared for today, and I will make sure Ms. Stapleton gets a copy of this, is just a compare and contrast of all the Republican alternatives to the ACA. In the event the Supreme Court had ruled for King, there were probably 4 to 6 Republican alternatives that were percolating to the top. Almost every one of those involves the establishment of state exchanges as opposed to a federal exchange. I'm not sure if that's been responsive or... Well, you don't have to do any of this now.
Right. We don't have to have an extended exchange for 1332 waiver. No.
No. In fact, so the state of Vermont is pursuing single payer.
Right.
And you don't need an exchange if you're going to go single payer because you're not shopping for anything. You don't have any choices.